This real-world study of its kind is giving us new insight into who should take the newest antiviral drug aimed at fighting off COVID-19. Medical reporter Liz Bonis shares the results.
Hey there, hello to you. Taking the antiviral treatment Paxlovid can reduce a person's chances of getting really sick from COVID-19 and ending up in the hospital. But now a new study in the New England Journal of Medicine says if you are 65 and older, it really works. But in younger people, we may not see that same benefit. For weeks now, many requested this medication as part of the Test to Treat program for COVID-19 at pharmacies such as the Cedar Care Village Pharmacy near Ohio's Cedarville University.
It works very similarly as Tamiflu does against the flu in that it slows down the replication of the virus in the body.
Well, early on, many were warned the medication can interact with other drugs to treat heart and GI problems.
My concern was, what do I do? And so I opted not to take the medicine.
There may now be another reason those such as Terry Allen may choose to opt out. This real-world study looked at nearly 110,000 people to find out how well the drug works against Omicron. They tracked hospitalizations and death rates in people who were vaccinated, had a previous infection, or both. 4,000 people in the study were given the drug Paxlovid. In those 65 and older, there was a 70% lower chance of ending up in the hospital and nearly 80% lower chance of dying of the disease compared to people in the same age group who did not take the drug. But people ages 40 to 64 had no significant drop in the risk of hospitalization or death. While Paxlovid is recommended for those who have other risk factors, such as high blood pressure, obesity, and diabetes, the authors of this study concluded age may be even more of an important consideration, and the drug had no evidence of benefit in younger adults. Now, of course, your own healthcare provider, the best person to assess benefit versus risk of any medication for your health. I'm medical reporter Liz Bonis. Now back to you.